All right, so I'd like to introduce you all to our first speaker. Her name is Cap Wilkes, and she is our Cap Wilkes. She's our Director of Program Development, and so I'll turn it over to you, Cap.
Great, thanks Angie, and welcome everybody to our Network Development Grantee webinar, our TA Introduction. We are your technical assistance provider and are going to spend the next hour talking with you about our TA team, sharing our TA approach and our strategies, describing technical assistance, methods, and opportunities, those things that you'll be interacting with us, and also presenting some TA events that are coming your way here even in the next few weeks. So we have a bunch of speakers today. I'm going to start us off, but we will be sharing the microphone with the rest of the Network Technical Assistance team. I'm really glad that you're all here. I see names that I recognize, and I'm looking forward to getting to know those that are brand new to us. And I see some of our federal office folks are on the line as well, so that is fantastic. Just a couple of extra housekeeping things. It'd be great for you all to add your name over to the right side of the Adobe Connect page. And just to highlight some of our Adobe Connect methods is this particular way of entering is called a short answer poll, which one of the things we love about it is you can edit your answer. So your answer stays visible to you up at the top, and you can change that as you go along, which is different than a chat box. So feel free to keep signing in as I start us off here on our webinar. I'd like to get to know you all. There are some of you that are familiar with us through some past grant projects. We also have folks that are brand new to the grants that we have been providing support to from technical assistance, and some of you on the phone have never received technical assistance before. So we have a nice broad range of diversity of participants in today's webinar. And as I said, we're going to spend the next hour or so talking through our TA methods. I'm going to switch our screen now. So here, take a minute to adjust, and we'll pull up our PowerPoint presentation. Your TA is being provided by a team of us, 8 altogether, working with Rural Health Innovations. RHI is a subsidiary of the National Rural Health Resource Center. In partnership with the center, RHI connects rural health organizations with innovations that enhance the health of rural communities. We act as a technical assistance center and a knowledge center for rural health organizations across the country. We're located in Duluth, Minnesota. It's a harbor town at the tip of Lake Superior. You will definitely hear us complain about the weather, but really we do love it here. It's a beautiful place to be on the shores of the biggest lake in the world. We'll occasionally even share pictures in our monthly newsletters. So speaking of that, you are all actually very welcome to also send us pictures from your place, but more on that later. Also in this presentation, we'll be introducing ourselves to you, your network TA team. We know a lot about rural health networks. The center and RHI originated out of a rural health network in northeastern Minnesota, the upper part of Michigan, and the northwestern part of Wisconsin. With its network roots and through extensive experience working with rural health networks across the country, the center has acted as a knowledge center for rural health organizations since 1987. And we've been working specifically with networks since 2009. We completed a national survey of networks and a summit of network leaders that got us started thinking about networks and understanding the reasons that rural health networks form, what their members value, and best practices of sustained networks. We know, and you know, that rural health networks come in all shapes and sizes and really are born out of the needs of the communities that they serve. One foundational tenet that came from our early work with networks is that we are better together. and this is our motto. This motto has shaped our work when providing technical assistance. Now, we have served more than 250 rural health networks. We have provided technical assistance to the Rural HIT Network Development, or written grant, from a few years ago. We provided TA to networks involved with the Health IT Workforce Grant, a couple of cohorts of network planning grants. Most recently, we've been working with another workforce-oriented grant program, the Allied Health Training Program, and we're actively saying goodbye this month to the outgoing network development grantees, and now welcoming you and saying hello to the newest group of network development grantees. Some of you overlap in those areas of the technical assistance we've been providing, and we say hello to the new folks and welcome back to those that we have been working with in the past. Our work with networks has strengthened our understanding and commitment to our motto that we are better together. We are truly convinced that rural health networks, with their natural focus on collaboration and shared problem solving, are a long-term solution for rural communities to sustain the healthcare organizations in their communities and support wellness. Here's your group, the group of Rural Health Network Development grantees in 2017. There's 51 grantees, and we have 3 years to work with you. We're also looking forward to continuing to work with our FORHP, the Federal Office of Rural Health Policy, our colleagues. Our project connector coordinator is Jane Berube. The project officers are Marsha Colburn, Michelle Prey-Gibson, Cassie Phillips, and Megan Lincoln. We would like to get an idea of what experience you all have had with technical assistance. So I'm going to bring up a poll quickly. These are one of the things we like to do when we're working with you all, is get a little bit of input when we have the opportunity. This is a poll that you should be able to answer more than one of these questions if you would. This kind of response helps us design our resources and deliver our technical assistance to you over the coming months. Over the past month, as you've been getting ramped up with the grant, we've been getting ready too. One of our jobs has been studying your applications in an effort to get to know you, with the overall purpose of the grant program being to expand access to, coordinate, and improve the quality of essential healthcare services and enhance the delivery of healthcare in rural areas. You all are coming into these program goals from many diverse directions. Our job as your TA provider is to help you succeed. So thank you very much for input on this poll question. It will be helpful for us as we continue to develop your TA. I'm going to hide this now and get it out of our way. The Center's and RHI's organizational vision is collaborating and innovating to improve the health of rural communities. This vision is what we're aiming for as an organization, and it aims our work for you. The network TA team goals are aligned with this vision. We want to help networks to improve health in their communities, support the growth of your capacity as a network organization to be sustained organizations, to strengthen you as network leaders, and assist networks and their members in transitioning to value. Please keep in mind through this presentation and over the months to come that we believe in your efforts as networks, bringing communities together, and we are dedicated to helping you be successful in meeting your program outcomes and sustaining your network. And with that dedication, we'll provide you with relevant and pertinent technical assistance through education and resources. Through the next slides, we'll introduce our network TA team to you and explain our TA approach in general terms. And then a little bit later on in this webinar, we'll spend a few minutes talking about specific technical assistance. I'm going to turn the microphone over to our next speaker.
Good afternoon. This is Alyssa Miller, and I'm the Chief Operating Officer with Rural Health Innovations in the National Rural Health Resource Center. I am part of my role here at the center is I oversee our financial budget, human resources, and information technology areas. But in addition to those administrative duties, my background in areas that I'll be working with the network team on focus around my 10+ years experiences with Medicare and managed care, Medicaid, and Medicare programs, specifically as we're seeing transitions in our healthcare system and different payment models being tested, and the involvement and importance of care coordination in meeting the needs of population health and these new payment programs as well. Sally Buck and Terry Hill are not able to join us today. Sally is the National Rural Health Resource Center CEO. Terry Hill is the Rural Health Innovations Executive Director. And their role and with our team really will focus around leadership development, and so you may hear their voices and their involvement on webinars in those topic areas. And they really help us in our strategy planning and content development in helping keep our oral information current and up to date. Thank you.
Hi, and this is Cap again. So I am the Director of Program Development here at the Center and RHI, and I manage the Network TA team. I will be working with you directly and also supporting development of our TA resources, working with our team to focus our resources so they're both relevant and pertinent for your work. My background includes working in many types and sizes of businesses. I come from a large retailer experience within the finance department, all the way down to small nonprofits providing education and facilitation. And I've come from experience from a rural health network here in Minnesota that delivered HIT services to 15 critical access hospitals across the state. I'm right now actually teaching in a rural health MBA program, an organization development class, and also have a class in the middle of the year in the wintertime in the area of performance improvement. So I'm thinking often about how change happens and how organizations can manage that change, and really am in love with the Baldrige Performance Excellence Framework. I am also a gardener, which has taught me patience and also gives me a great creative outlet. And I've lived in the Red River Valley up in northwestern Minnesota and spent several years up there as a farmer. Thank you, Deb.
Good afternoon. My name is Deborah Lane, and my role at the center is program specialist. And as a program specialist, I look at myself as providing education and doing a lot of coaching and whatever technical assistance might be needed by any grantees that may call in or that we may be working with. All to rural health networks, and topics that you'll hear me talk about are strategic and business planning, some evaluation work, very interested in collaboration and community engagement, and that whole piece of partnerships and working together. And then it's really important to me to build capacity and empower everyone as a leader. I guess really when I think about my work, I look at it as empowering you as network leaders in order to accomplish the good work in the communities that you're serving with your grants. I come to the center with over 30 years of adult education experience, and most heavily in the years 10 or 15 years previous to coming to the center, I did a lot of work with designing and developing and implementing and then coordinating education programs across northern Minnesota and working cooperative with a lot of different rural healthcare organizations throughout our region. And I have always lived on a farm. A few years when I went to college, I lived in a dorm, but otherwise, I grew up on a dairy farm in central Minnesota, and for over 36 years, my husband and I have shared his family homestead in just outside of the Duluth area, and I'm a shepherd. We have a small flock of sheep and a few chickens and a few other sundry animals, and I'm just really looking forward to be working with you.
And good afternoon. Again, this is Angela Flam. I am a senior program coordinator with the Center and RHI. And I currently am a TA contact for the Allied Health, the Rural Network Allied Health grantees. I work with 10 networks across the country on allied health provider initiatives. And I will also be the direct TA contact for 10 of the new development grantees. What I will be doing is providing education, coaching, tools, and resources, all things that will help you all meet your project goals and also help you with your grant deliverables. Becky?
Hello, everyone. My name is Becky Gord. I'm a program coordinator on the Network TA team. I've been with RHI in the center for just about 2 years, and I'll be the primary TA contact for many of you. I support the team in developing educational opportunities and resources and helping to coordinate other events and projects along the way. I have a special passion for nonprofit management and governance, as well as social justice and health equity. So I spend a lot of time volunteering for nonprofits and international NGOs along those lines. Something else about me is that I used to work for a blood center, and so I would attend a lot of community events and work a booth to offer free blood typing to people, which is a really quick process, but it involves pricking the person's finger. And I was always amazed at how willingly people would come up to my booth and give me their fingertips so that I could jab them with a needle to get them to bleed. And yet the same people would also mention that they were too afraid of needles to go through with donating blood. So I think back to that experience a lot and use it as an analogy in my personal life or my professional life even to help me understand that what people think is holding them back from doing something good is often not the thing holding them back at all. Kiera?
Hi, my name is Kiona Hermanson. I'll share a little glimpse into my personal life first. I'm originally from southwest Minnesota, where I grew up in a rural community. Our high school is located centrally between the towns, and it was actually in the middle of a cornfield. So like I said, my name is Kiona, and I am the program coordinator for the Network TA team. A lot of my time is spent working on the behind-the-scenes duties to help the team as a whole work as efficiently as possible. As we begin communicating, your questions may be directed towards myself by default. I'll do my best to answer them, and if I'm unable to, I will gladly direct them to the appropriate staff member. You'll be hearing from me in the near future as I send out communications to your network while scheduling and hosting upcoming webinars.
Great. Well, we do have a fantastic TA team, and we're quite excited to be here together in this intro webinar and saying hello to you. As a team, we walk the talk of strategic planning, and this year during our annual planning retreat, we identified 3 strategies to guide our work toward our goals. We do approach TA from a coaching perspective. We approach our work from the angle of teaching how instead of telling what to do. We work on educating for capacity building. We seek commonalities while acknowledging that you each have a uniqueness. Your partners are unique, your service area is unique, and your project is unique. Here in the Duluth Port, we have ships arriving every day. They come into the port to load cargo, to unload cargo, to move things around the world. There's lakers and salties and barges. In fact, you will often or possibly hear a horn every once in a while. We are located literally right next to the lift bridge, which is the image in the middle of the screen. Our building is just behind the vertical on the right side of that picture. It's a great spot to see ships come and go, and we love to hear the horns. And you guys will be able to hear those, I'm sure, over the months to come. We also utilize a framework to understand and identify technical assistance needs. It's like having a solid and firm foundation to properly frame a building. The more solid the foundation, the more solid the framing. This strengthens the work of our technical assistants so that it can strengthen your work. An idea, a metaphor might again be our aerial lift bridge. The framing of that lift bridge makes it sturdy and able to withstand the gales of the north winds of Lake Superior and also the ships that come through it. Back to you, Deb.
Thank you, Cap. Last week, the state of Michigan was anchored at the harbor just behind our building. It's a training ship. It's a training ship that's used as a daily laboratory environment for the Great Lakes Maritime Academy. And when it's underway, or which means when it's moving or out of its own port, the cadets from the Great Lakes Maritime Academy use it as an opportunity to practice what they've learned in the classroom, to practice their theory and their skills. The aim for sustainability is a learning environment. It's an environment built on a framework, just as the cadets learning at the Great Lakes Maritime Academy is structured and built on a framework. The underlying framework RTA is built on includes characteristics that make a network strong and make a network sustainable. This means that, we really do have a rhyme or reason for the way we develop our resources and provide our technical assistance. Having a framework also means that we're using a systems approach to our technical assistance because this is a list of characteristics, and it's not linear. It's just a list of ideas, but each of these interacts with each other. And in this complexity, your network organizations must do all of these things and do many of them at the same time. Therefore, RTA, to meet our goal of meeting your needs to improve health in your communities, we will be using these ideas about successful networks in order to develop and to deliver the technical assistance that we provide. The framework that we're using is founded on knowledge that we gained in a study on sustainability factors of networks. In fact, many of you contributed to the data in our study over the past couple of years. The results of the first year of study identified 6 key characteristics of rural health networks. We are using this list of characteristics to base our framework on for the next coming 3 years that we'll be working with you. We've been developing our thinking of each of these characteristics and organizing our TA and our resources around them and within them. The characteristics that the study revealed were leadership, collaboration, member-driven, communication, evaluation and measurement, and financial infrastructure. In our consideration of sustainability, we've also included 2 of the Baldrige Performance Excellence components because they are also very critical to successful and sustainable networks. And that would be workforce and culture and process and operations. So that's a little bit of background and fundamentals on the technical assistance approach that we take. And this is where you probably might be starting to notice the difference between TA that you might have received in the past. We've incorporated our knowledge about adult learning, facilitation, change management, and process improvement best practices into our methods. At a high level, our approaches will reveal to you things like multiple modes of education and knowledge sharing and communication. You'll see us focus on leadership development and capacity building. We support a culture of continuous improvement, and we try to facilitate knowledge sharing and an environment of innovation and creativity. And we do spend time translating business concepts into network terminology because they are very tried and true processes. I guess you could say these methods serve as a beacon for our technical assistance, just as the Duluth Lighthouse serves as the beacon for ships to enter our harbor. Here is the basic outline of the technical assistance that you will experience. When ships come into the Duluth Superior Harbor, they have a choice, as you can see, of many berths or many places to go. It's not uncommon for a ship to come in and go into more than one berth in our port. Sometimes they go to the Calumet fuel dock. Others go further into the harbor to unload, while others head right for the ore or coal docks to load. When you enter our harbor of TA, you have many things to choose from that meet your needs at different times. And these things include ad hoc questions, one-on-one check-in calls, peer group calls, site visits, reverse site visits, a technical assistance plan, and support for your grant deliverables. As a ship enters the port, they have some easy access options for them to choose from. Just as you will have some easier access technical assistance that you will be able to access. And this is a list of things that we have either provided in the past or we anticipate providing for the next 3 years working with you as a group of grantees. There'll be webinars just like this one. There'll be peer information directories. And one of the most important ones to you most immediately will be a directory of all of you who have Rural Health Network Development grants. And it'll provide you with a way of communicating with each other And we really appreciate it if you keep us updated with any changes to your project leadership or primary contacts, so we can make sure that that directory is as updated as possible. Then there is a source book, and these are shared at the end of your program, and this is to facilitate peer learning and enhancing and continuing relationships after the life of your grant. You will be receiving a monthly newsletter, and we'll be talking about that in a bit, as well as we'll be talking about our website. And there's just a whole ton of information on that website for you to be using. So we really encourage you to check out both that newsletter and our website. At times, you may be experiencing some rough waters or going into some uncharted territory. And this is a time to reach out and ask questions. The entire TA team is available to you for direct TA, meaning please call or email us with your questions. If you start with one of us and it's not a topic that we are specialists on, we have someone that we can refer you to within our team to make that handoff to someone who really has experience and knowledge in that area. We also are able to leverage many of our relationships with experts on rural health and rural health networks across the country. We use a help desk system to keep track of our issues, and so this is a way that we can effectively work from one team member to another, but we also have bi-weekly team meetings where we try to keep ourselves updated on things going on in healthcare and also questions that our various grantees have. Direct technical assistance. This is pretty straightforward. It's just calling or emailing us directly, and we will be providing our contact information at the end of the webinar. And when you download it, you'll be able to have it that way, as well as you can see how to contact us here on this slide. Check-in calls for some networks seem to be the main entrance into our harbor of technical assistance. One of our specific direct TA methods is one-on-one check-in calls. Some of you have experienced a TA approach that included regularly scheduled monthly calls with your TA providers. In our approach, we have 5 annual one-on-one TA calls and small group peer-to-peer calls. The first round of one-on-one TA calls will take place mid-September to mid-October. Each of you has someone on our team that will be calling to talk to you about your project. In the next few weeks, you'll be receiving an Outlook calendar invite to reserve the time, and it will provide an agenda and call information. We will also be providing you with a TA needs assessment to complete prior to this check-in call. In one-on-one check-in calls, we want to hear from you what you need help on and get to know your projects better so we can anticipate what things might be helpful in the future. Angie?
Hi, this is Angela Flanagan, and I'm going to continue to talk to you about some additional ways that we will deliver technical assistance to you. So one of them is peer group calls. Peer group calls are moderated discussions, and they are used as an opportunity for you all to learn from each other and problem solve alongside your peers. These peer group calls will take place approximately once a quarter and will be designed based on a general topic that is relevant to the group at that particular time. You'll be receiving a calendar invite very soon for our first peer group call which is going to be about developing products and services, and that's going to be held on August 10th. So you can watch your email for calendar invites for that. Pictured here is the Coast Guard's Cutter Adler. Its role, of course, is to break ice late in the shipping season and in the spring. But she also tends the buoys that keep the ships from running around, running into each other, and hitting obstructions under the water. These peer group calls are ways to learn about ice-breaking ideas, learn from each other so you don't run aground or hit any hidden obstructions. There will also be 12 on-site TA visits this year, starting this fall and running through June of 2018. On-site TA visits are one-on-one TA visits where RHI will come to your state and provide support through training, facilitation, planning, and problem solving, depending on what you and your network need. On-site TA visits are determined by a selection process which consists of completing a request which will be sent to you quarterly. Your first opportunity to request an on-site TA visit will be included in the upcoming TA assessment, which is scheduled to be sent to you very soon. In the application, you will provide potential dates, describe the TA topic or topics that you and your network would benefit from, as well as describe the expected outcome or impact desired as a result of the on-site technical assistance visit. Selected networks will be decided via the network request, the project officer recommendation, and also from responses from the TA assessment. So this is something you can start thinking about now. An on-site TA visit can be similar to one of the tugs in our harbor guiding a ship. Another area of technical service that we provide here at RHI is our reverse site visits. And these are like workshops. One of these reverse site visits will be something called an all-grantee partnership meeting, and this is going to take place in March of 2018. There'll also be 2 smaller workshops throughout the first year of your grant, and we'll use information from the completed TA needs assessment to determine topics for both of these workshops. And similar to the on-site TA visits, there is also a selection process for being able to attend these workshops. And we'll provide more detail on this process in a separate email, as well as our one-on-one intro calls that we'll have with you all individually. Almost all of our incoming ships make a stop at the Calumet fuel dock. Coming to these reverse site visits and workshops can be like coming in for fuel. A previous grantee said that the workshop that their network attended gave them that renewed energy and momentum to keep them moving forward. Let's see. And so as no ship leaves the harbor, or as no ship leaves without a route or a map to its destination, it's our hope that the network's individualized TA plan will serve as such a map. The importance in completing the network TA assessment that will be coming to you soon is so that we can gather meaningful information about your TA needs and insights on your network development. This information is used to build your individual TA plans as well as assist us in identifying topics that will be useful to you in regard to resources and education. Your individual TA plans will include technical assistance, aiming for sustainability resources tailored to your network, upcoming learning opportunities, as well as due dates for your project deliverables. Speaking of deliverables, as Jane mentioned in her kickoff webinar a few weeks ago, we'll be providing you with tools to help you complete your grant deliverables. These tools will generally consist of a guide, a template, samples, and then a webinar explaining this toolkit. And you'll also receive one-on-one coaching around these deliverables during your TA check-in calls. As you're experiencing today, we use a combination of phone conference and Adobe Connect to provide you with education resources. In past years, there have been 6 webinars. These webinars have typically been used to share deliverable toolkits, as mentioned on the previous slide. Also, background education for deliverables. For example, conveying the benefit of intentionally doing strategic planning and evaluation work. Education on topics identified from TA assessments are also we also utilize webinars to provide education on topics identified from your TA assessment. And we'll use the TA assessment results to also determine common threads in which to provide additional education. Webinars are also the platform used for topics identified by your project officers. Oftentimes the project officers will suggest areas of education that they feel are important. And finally, we'll utilize the webinar platform for providing education on current events happening in and around healthcare. So in other words, when major events or changes are made to the environment we work in, they will become a topic of these webinars. As I indicated before this webinar started, all of our webinars are recorded, and a recording link along with the PowerPoint and any materials from a webinar will always appear within the recent webinars and resources page of the development pages on the RHI website. You'll be sent the link in an email once it's been posted to the website. And so like the picture in the slide, these webinars can be a bridge to you completing the work your network has set out to do. Becky?
Thanks, Angie. This is Becky Gord again. And one of the other ways that we provide TA is through our monthly newsletter, Networking News, which we send out to network contacts for this network development grant, as well as for the Rural Network Allied Health Training Grant Program, which we also provide TA to. In the newsletter, we include program updates, upcoming events, featured resources, along with an article on a network development topic contributed by a network leader or subject matter expert, and a Q&A network spotlight that showcases a grantee of one of the network grant programs we work with. The newsletters are another way to learn from other networks across the country and feel comfortable connecting with them in the future to share insights. And if you're interested in participating in any of those features, please let us know. As we've mentioned a couple of times today, our website is one of the tools we use to make resources and updates available to you to access at your convenience. The link at the bottom of this slide will take you to the Network TA page on our website, and we are smack dab in the middle of updating the format of our website across the whole organization, so things may start to look a little bit different in the near future, but all the information you need will still be there. And if you haven't been to our website yet, we do encourage you to take a look around. From our website, you can access recordings and materials from recent webinars, tools we've created to help you complete your plan deliverables, information on important dates or events, and a number of other resources available in the full resource library for RHI in the center. Almost all of the ships that come into harbor here take on some kind of load, and in the picture, this laker is taking on taconite pellets. It's our hope that you will take on information by visiting our online resources. Ultimately, all of us working in and with rural health networks networks are trying to make a positive impact on the health of our communities in ways that can be sustained well into the future. Based on our experiences supporting rural health networks over the years, we've created and collected a number of resources that support the development and operations of networks, which you can find by searching in our online resource library. However, we've identified a special collection of resources in what's called the Network Aim for Sustainability portal to make that process easier for you. The portal is a compilation of 8 topics based off of the framework that Deb mentioned earlier: leadership, collaboration, member-driven, evaluation and measurement, communication, financial infrastructure, workforce and culture, and process and operations. And each category within the portal contains individual resources designed to support networks in that area. And the portal really is a dynamic tool. We're periodically reviewing it and updating the list of resources available there, and we're always working on developing new resources based on the needs of the networks we work with. So we encourage you to explore that portal and keep it in mind for the future. You can find the link there at the top of this slide. At the National Rural Health Resource Center and Rural Health Innovations, in addition to the work we do with networks, we also provide technical assistance and services to other types of rural health organizations through a number of different programs and projects. And another project funded by the Federal Office of Rural Health Policy that we're involved in and wanted to let you know about is called the Small Rural Hospital Transition Project, which you'll often see shortened to SRHT and affectionately referred to as SHIRT. SHIRT supports small rural hospitals in making the transition between the current volume-based healthcare system and the emerging value-based system of care delivery and payment. To be eligible to participate in SHIRT, hospitals must be located in a rural persistent poverty county or a rural census tract of a metro persistent poverty county as defined by FORHP, and have 49 staffed beds or less as reported on the hospital's most recently filed Medicare cost report. In the current year of the project, 9 hospitals from across the country were selected for on-site financial or quality improvement technical assistance. And apart from the on-site technical assistance provided through SHIRT, this project also provides educational opportunities and resources geared toward helping small rural hospitals transition to value-based care and alternative payment models. On the screen here is the web page for the SHIRT project, which includes a link to the Rural Hospital Toolkit for transitioning to value-based systems. And similar to the Network Aim for Sustainability portal, this toolkit specifically shares best practices for improving financial, operational, and quality performance to position rural hospitals and networks for the future, as well as strategies for transitioning to value-based payment and population health. The toolkit can be accessed by you or any of your network members at any time on our website, and it includes a self-assessment to help determine an organization's current capacity in those key areas. Here we provided direct links to those areas highlighted in the Rural Hospital Toolkit for transitioning to value-based systems, so you can explore any of those directly. As network development grantees, you're also eligible to take part in the web-based educational opportunities and resources developed through SHIRT at no cost to you. So if you haven't already, you'll soon start seeing email announcements with information about the Health Education and Learning Program webinars, or HELP webinars for short, Performance Management Group calls, or PMG calls, and the SHIRT newsletter called Timely Transitions, which features examples and best practices on population health and hospital performance improvement.